This conference will now be recorded.
All right, thank you. You can go ahead and step in, Rita.
Thanks. I would like to actually introduce, we have, I think, our whole team here. So the MODA surveillance team is a group that works under MDHHS, or the state health department. We have 3 analysts and 3 epidemiologists who work in environmental health surveillance. And we work with a wide range of data sets. And we're really here to just have a discussion about how we might be able to support you all in the work that you're doing. And so I'll have, I guess, everyone on our team go around and introduce themselves, and just, give a little blurb about what they do in regards to overdose surveillance. And if all of you would just start thinking about the things that you might like us to talk about on a training seminar or in a course, that's really, we didn't necessarily come with a list of questions for you, but we were hoping that y'all maybe have some questions for us that we can then answer in depth during a sort of data TA course. So let's see, I see Sarah Rockhill, do you want to start?
Sure. This is Sarah Rockhill, and I serve as the lead epidemiologist on the MODA surveillance portion of the MODA grant. Is there anything specific you want me to touch on, Rita?
If you could just talk maybe a little bit about some of the sources that you specifically work with, like the naloxone standing order data, for example.
Sure. Sorry about the background noise. Our IT department is trying to catch us. So I do manage a couple projects under MODA. So one is our naloxone standing order system, which is, if you're not familiar, any pharmacy in the state of Michigan can register to dispense naloxone directly to consumers. Anyone can walk into a pharmacy and walk out with a prescription for naloxone without having to see a doctor. And so we manage, the registrations for that, and we also do quarterly data on how many prescriptions are dispensing, so we can track that over time and throughout different geographies. I also work with some data from the Michigan Hospital Association. So we get discharge data on inpatient stays as well as emergency department visits from almost every single hospital in Michigan. We also get some data on Michigan residents who are hospitalized outside of the state as well. I'm sure there's other important data sets that I should touch on, but I don't want to steal anyone else's thunder because there's a number that we kind of co-manage as a group. I'm assuming you want to talk about my celerity at some point, but I will defer to you and Gabriella about that.
Awesome, thanks, Sarah. And I don't know if anyone came with questions about Excel or coding, but I think Sarah's our by far most talented computer savvy staff member. And so if anyone has, needs help with like R coding or maybe some fancy Excel capabilities, Sarah's our star with that.
Real quick, Rita, somebody asked in the chat if there was a list of the pharmacies that participate in that naloxone prescription system.
Yeah, so there is a list that's actually publicly available on the MDHHS website, and I can add the link to that particular website without hiding it. And also I can provide that in an Excel form just directly if anyone wants to email me because the one on the website's updated monthly, but my list is updated, in real time. So if you want a really, really up-to-date version, you can contact me directly. Otherwise, it's available online.
Okay, and are there stats for the number of people who utilize that naloxone through those pharmacies? Do you guys get reports on how many people use that, and is that publicly available?
So when you say people that use it, I'm assuming you're talking about like members of the public who come in to like fill a prescription, right?
Yeah, yep, to fill the prescription.
Yeah, we don't track individuals, but we do track prescriptions dispensed. So
Okay.
I can tell you that, 10 prescriptions were dispensed from pharmacy A. I can't tell you if that was for 10 different individuals or for the same individual, but that's kind of how we track it. We track the number of dispensed by quarter. So right now we're getting in data from April through June, and then we issue a report at the end of each following month, the month following then.
All right, thank you. I'll follow up with either you or Rita to get that link and that information.
Gabrielle, did you want to quick pop in?
Sure. So I am Gabrielle Stroh-Steiner. I'm the Surveillance Projects Coordinator under the MODA grant. And I work on a variety of projects. I work on reports and different analyses, data requests, grant management. I think we all kind of wear different hats on our grant, but we all collaborate a lot. And Sarah had briefly mentioned My Celerity, which is one of our newer data sources. So that is one of the sources that I work with that I'll highlight. And so that is a new surveillance source our team has been working on with CDC funding over the past 2 years. And it is an automated emergency department overdose surveillance source. And so we refer to it as near real time. So it's one of our most timely and non-fatal data sources. And we are just starting to roll it out to local health departments. So the goal is really to get all local health jurisdictions access to timely overdose data. And so, yeah, like Sarah said, we have a variety of other data sources, and I'll let the analysts highlight the sources that they work with.
Stephanie, do you want to go?
Okay, I'm Stephanie. I'm an analyst. I work with EMS data. I work with one of the emergency department data sets. It's kind of in the middle for how timely it is, but it has the addition of chief complaint data. And then I work with rapid postmortem toxicology data for 50-some counties in the state. That's me. And any questions?
Okay. Cathy, do you want to go? I see you're unmuted.
Yeah, I'll go ahead and go next. Yeah, my name is Cathy Boynton, and I am the drug morbidity data analyst, and I work with the Michigan Health and Hospital Association data, which the first one includes all the outpatient data, which is basically where we get our emergency department information from, and we get that quarterly from them. And then I also work with our hospitalization data. So those are the two data sets that I basically focus on right now.
And then I don't see Sam Jones on, but Sam is our other data analyst, and she works with a set of data that is created from abstracted medical records that come out of medical examiner offices. So all fatal overdose cases. it is certainly not a very timely data source, but it's very detailed, and you know, we can certainly pass on any specific questions about that. It's called Suitors, and you can actually find some information about it online because it's a national data set. It's State Unintentional Drug Overdose Reporting System. Anyway, so let us know if you have questions about that as well. And so that's our team. And yeah, we really would just like to have it hear from you guys about what you're interested in learning about, if there is anything that you know, even just think that maybe there's a gap or something where, you know, you kind of have a feeling that maybe things could be better, but you don't even really know yet. You know, like this is an open place to just have a discussion about all of that. So, I mean, Charlotte or Hara, I don't know if you guys had like specific leading questions in mind, but otherwise I'd be good with anyone just jumping on.
Yeah, I'll open up the floor for, does anybody have any questions for Rita or the data team specifically about any data that they've had trouble accessing, questions about accessing data or anything like that? I know in the past, Rita, we had discussions with people in rural areas about the hospital data. Is that public data for everybody that they can access if they're looking? Or do they have to like go talk to you guys and do a request to get that data?
Cathy, Cathy or Sarah, do you want to talk about my tracking a little bit and the hospitalization data?
So I can jump in, and Cathy, please fill in the gaps if I miss anything important. The hospital data that we work with, it's just from the Michigan Health and Hospital Association, so it is a proprietary data set. We can't, you know, pass on the raw data, but we do use a lot for data requests. So, I mean, the raw data probably isn't that useful for the majority of users anyway. You know, sometimes it's millions of records, and you kind of have to know how to work with it to make sense out of it. But if you have like a specific question in mind, say you want to know, you know, did hospitalizations increase in my target area, you know, over this specific time period you're interested in, for a particular demographic group or for a particular type of overdose, you can field those questions to the MODA surveillance team, and Cathy is our, you know, MHA data analyst extraordinaire, and she's really good at manipulating the data in a way it can give the end user insights. I mean, certainly I don't want to discourage you from pursuing the raw data if it's something you think you would be interested in, but I just wanted to be transparent that it's something that we purchase, and so it is kind of a heavy investment to get the raw data, but you definitely probably don't need raw data for most things. So
yeah, and to jump in, oh, I'm sorry, Sarah, I didn't mean to cut you off.
Go ahead.
But,
I was just transition to my tracking, but I'll let you take that, Cathy.
oh yeah, and just, you know, to throw something in there too, in that the data set, like the MODB, the outpatient data set, is over 21 million records. So it's a huge, you know, it's a huge monster. So a lot of times it is easier, you know, it's to put in that data request and just, you know, ask us specifically what you want. So yeah, go ahead on my tracking, Sarah.
Oh, sure. I was going to mention that we work with a group within MDHHS that has an online data visualization, I guess you'd call it, platform where the user can go in and put in different parameters and pull up maps and graphs and like tables and anything that you could probably think of. We don't have the hospitalization data up right now, but it's something that we're working on. But we do have some mortality data up. So if you're interested in, overdose or mortality rates for a particular county or a particular demographic group, that's a really good place to start looking.
Thank you for clearing that up. That makes a lot more sense about how somebody could fulfill a data request for hospitalization data. Thank you.
I have a question. This is Mary Gaskin.
Hi, Mary, go ahead.
My question is, are you tracking overdose to the largest metropolitan city? For example, small suburban city located next to Detroit.
You're cutting in and out a little bit. Would you mind repeating the question?
Okay, my question is, does your data show the small city overdose? Are you comparing it to Detroit? Let's say Dearborn and Detroit. Is that a data that will show you the increase or the decrease in the population a certain time of the month?
So I think I caught the gist of your question, but please correct me if I misinterpreted. If you're interested in a particular community that's smaller than the county, so I know county data is really easy to get, but sometimes your service areas for a particular city or even a particular neighborhood, we have a couple of data sets that would allow us to look at that. So that's really the benefit of having this open communication between you and the MODA surveillance team, because it's usually not data you're going to find online. It's something that we can personally create for you, and we'd love to do that. But that's where you would really need to reach out to us either through Amy or through that MODA surveillance inbox. And we can really try to understand exactly the very specifics of the data you're looking for. But yeah.
Well, I've done my thesis back in the 80s at Wayne State University, which was substance abuse among adolescents on Lower East Side, and I compared Detroit versus Grosse Pointe at that time. So I just wanted to look at it and see that you have that type of information.
Yeah, one of the nice things that we have about in the MHA data sets, the Michigan Hospital Health and Hospitals, the hospitalizations and the outpatient, is that we have census tract data and we also have city. So it is de-identified, but we do have those that we can try to get to jurisdictions that are below a county level.
Thank you.
Marion, it sounds like somebody else might be able to help you too from University of Michigan System for Opioid Overdose Surveillance. So if you want, I can connect you with Robert after this.
Thank you very much.
Yeah, no problem.
And hearing specific examples like that is really helpful for our team. So if anyone else has specific examples of ways that they have used data to inform the work that they're doing, and then what they wish they could have done differently, or specific examples of things that you would like to do, but you're not quite sure what the next steps are, that would be really helpful.
Another question that I kind of want to bring up that Rita mentioned before was that we will be creating a course from all of this, and it'll be a data utilization and accessibility training. And I'm just wondering if you guys have anything specific that you would want us to include in that, like Excel trainings or a specific, you know, data set that you would want us to go through and teach you how to use. Are there any requests specifically that you guys want for a course, or what you would want your course to look like if you were going to take a course on data?
This is Linda Davis from Families Against Narcotics. I think, hi, how are you? We're great at collecting data, but really looking at how do you analyze it would be helpful, a course on that, like what kind of data should you collect, and how do you set yourself up so that when you're finally at a position where you have lots of data collected, which is where we're at, that you actually have collected the appropriate data to be able to analyze it. So I think a lot of people don't understand it. We, fortunately, we received a mini grant from MODA to hire an analyst, so I'm sure we're going to start learning on that. But it would have been helpful to have had that information 1.5 years to 2 years ago. So just forward thinking on as we begin collecting data, it would really be helpful if we knew what you guys look at in order to be able to analyze data so that we could collect it appropriately. So a course on that would be helpful.
Thank you. That is a fantastic addition. I wonder if you wouldn't mind talking a little bit more specifically about the maybe questions that you're trying to answer with data, or even if anyone else wants to pop in, you know, maybe you're at the beginning stages of collecting data or you're thinking about it, because I would really like to tailor the course to look at specific examples that directly relate to the work that you all are doing.
Yeah, like I could give you an example of what I would like to show is, I can talk for an hour about this, but I won't. I'll just give a couple of examples. But one of the things that I would like to do is that our program differs from a lot of similar like Hope Not Handcuff or QRT program in that we have layered services. When someone comes in, we don't just refer them to treatment and hope they get well, but we do lots of follow-up calls. We assign a peer recovery coach immediately. We assign a family coach if appropriate. We do scholarships for sober living, and then we continue to try to connect them. So a lot of programs only pay for like peer recovery services for 30 days. What we'd like to be able to track is, does long-term sobriety happen the longer you extend those services? So, you know, like, do those wraparound services really escalate? And I mean, not expensive services like an inpatient for 90 days, but if we could do peer recovery coaching for 90, or I would love to pilot a program like this, 90 days to 6 months, where you really had that one-on-one connection with somebody, your family did too, would that enhance your ability to maintain a longer term of sobriety? The other thing that I would love to be able to track is we do get repeat people through like our Hope Not Handcuff program, but I would like to be able to track whether or not each time they come back, does their length of being out using substances decrease? Like the more treatment they get, we oftentimes hear, well, they just keep coming back through your program. But if the length of stay that they continue to use shortens with time, the more treatment they get, then maybe it's not a waste of resources to be able to do that. And my last one is being able to track what services actually improve long-term outcomes for different diverse groups, like the African American population, Do they do better with one-on-one services? Do they do well with the community approach of supporting services? Those are all questions that I ponder at night when I can't fall asleep. And but I don't know how to even track it to be able to prove it. I mean, we know that getting into the Chaldean community, the Arabic community, is very, very difficult. So if we could kind of start really targeting what kind of services really do work with those demographics, then we could design programs around making sure that we don't miss those gaps and possibilities of treatment with people.
Yeah,
So
it sounds like
I'll stop.
No, that was great. It sounds like you're really asking the overarching question of, are we being effective? And if not, what else should we be doing? You know, what elements in our work are effective? And at least I'm hearing that maybe using data to evaluate the programs would be helpful, and just kind of walking through that process. And maybe even you and I can get together to write up a specific example that we could use in a course. I don't know if that would be helpful for people, but I mean, I always like to see, you know, just like a walkthrough example of something that can then be translated elsewhere.
Right. Yeah, I will, and Amy will attest to this, that when we first started our programming, I really didn't understand the importance of data. And the more we've worked with you guys, the more I realized that data-driven programs really are much more effective. And to be honest with you, I'm really tired of the waste of money that's given to programs that really are not proving that they work. And I don't want to be one of those wasteful programs. If we're being given dollars, I want to make sure that we're doing our part to make sure that we are utilizing every dollar of that. It's not just about getting money, it's getting results with that money. And I don't see that there is a lot of programming that really does rely on that, to be perfectly honest.
I had something I wanted to share. Oh, Stephanie, I want your opinion. So just let me mention quickly. You know, so I guess I want to talk a little bit about the trajectory of about what Judge Davis just said, because with Families Against Narcotics, with their intake, I shared what the SSPs, so the syringe service programs, what their intake looked like, because some people make up their own questions, right? And so if we can use standard questions and then transfer those over, the chances of that program having some good efficacy, and then, you know, we can kind of look at that language and look at those durations and have it be consistent. And we've done that recently with a different project that we're bringing into Michigan, the overdose death reviews. So, you know, it is important, I think, when you're developing those questions, to first look at other good programs, and then double check that those are good measures that you want to be collecting. And I know that FAN did that when we started the project with you.
Right.
I was wondering, so a question for Marie, do you have capacity for collecting some of your own data, you know, with consistency?
I think you're talking to me. It comes up as Marie Giannano, but it's actually Linda Davis. Okay.
Oh.
You set up the meeting for me, so
Sorry.
I apologize for that. But yes, we have been collecting on a spreadsheet, and we recently purchased a data system that we are transferring all of our spreadsheets into that. We've been collecting 3 years worth of data at different points in interviews, and we collect a lot of data with a lot of different questions with it, but now it's just getting that into a system where we can pull the data out and understand it. So that's kind of where we're at right now. And then we are developing impact surveys and things like that that we can send out to our populations. We're really focused on proving that what we do is effective, you know, and that it works. So that's where we're headed with this new money that we just got, and hopefully can develop a really sound system of looking at where our gaps exist and doing programming around improving it.
This sounds really interesting, but are you planning on sharing either some of your data or just like a list of variables with us?
Yes, once we get it, we obviously would share it. Yeah.
Okay, thank you.
Okay.
And real quickly, I just wanted to let Robert jump on and share a little bit about the U of M system for opioid overdose, if that's okay. You can go ahead, Robert.
We can't seem to hear you. There must be something with the sound. I see you wrote into the chat. If you try your settings.
You could also try to call in with your phone instead of your computer.
Yeah, or if you want to, feel free to type in the chat and I can share whatever you would like me to share. He said he's going to try calling in.
Something that I want to point out, I'm Amy Moore. I'm a contractor, MPHI, and I work for the state as a contractor to contract manage some of the MODA agencies. I just wanted to point something out. When Linda was talking, one of the things that thinking about peer recovery coaching and different peer coaching, when I was at the local health department, we would have clients that came in and wanted to go into recovery, and they would have 5 and 6 peer coaches. So they'd have a recovery coach, they'd have a housing person. But then as you get through that, where you initially go into recovery and you've got all these appointments, then by the end of year 2, a lot of these programs don't have a lot of support for the people that had initially gone into recovery. And I'm interested in seeing a little bit more coordination, but I think this is more of a systems problem, but showing that support long-term is helpful. And it can kind of be discouraging when a person is new at this and they've been just hanging out with their buds, but then now they have all these demands on their time and they have to be at certain places and make all this progress. So it starts out with this big structure, and then I feel like people just drop the client maybe after 6 months, 12 months, 18 months, a year. And this is all new, right? This is a lifelong journey, and so we're just kind of allowing people to drop off the map. So I will stop talking, and I think Robert came back on with the phone call, so I'm going to stop talking. But if we could get back to that comment, because it's important to me and I want to figure out a way to solve it. So hi, Robert, did you come on?
Hi, yeah, can you hear me now?
Yep.
Okay. Thank you very much. Sorry I couldn't get on. I don't know what the problem was with my mic. I had the settings my mic is on as far as I know. But anyway, I don't know if anybody's familiar with the University of Michigan System for Overdose Surveillance, the SOS, or System for Overdose Surveillance. That's a mapping tool developed by the University of Michigan. I'm from the Michigan HIDA, or High Intensity Drug Trafficking Area Office, and we partnered with U of M to develop the system. It's an open-facing, forward-facing public website, which I will give you the web address right now if any of you can type it in to take a look. It's System for Overdose Surveillance.com. So it's all one word, System for Overdose Surveillance.com. And if you can access that, that'll bring you to the University of Michigan Injury Prevention Center opening page. I see some heads nodding. So on the left side, you see a map of Michigan in purple showing EMS naloxone administrations. And on the right side, you should see a map of Michigan in blue showing suspected fatal overdoses. This is the public-facing access page, and then you would be also able to log in to more detailed data, which I'll describe in just a minute. But at least for the public-facing, yeah, go ahead.
I can't see what you're sharing. If you're sharing something.
I'm not sharing anything. If you
okay,
can you
describing
open
it.
up a new tab? If you can open up a tab on your computer. And again, it's System for Overdose Surveillance.com. It's all one word, .com. So I think some of you might be there, hopefully, and seeing what I'm talking about. But the two maps of Michigan are broken down by county, and if you hover your cursor over any county, you'll get a count of either EMS naloxone administrations, or on the other map, you'll get the overdose. And just below the map show the timeline that you are looking at. So that's just a real quick snapshot by county. And then if you can obtain a login, which I can send Hara the information on how to get a login afterward, that'll give you a lot more data. And I'm just going to open my tab on that so I can at least describe what you get. But you can get more information by county and by city. So I know our caller, I think it was Mary a little while ago, who was asking for information on suburbs close to Detroit. So I've called up on my screen Wayne County, and I have a dot map or a pin map of overdoses for Wayne County. And when I scroll down further, I have like a 7-day moving average. I have demographics broken down by age, gender, and race, and then for Mary's purposes, frequency by city. So they do list individual cities and the incident numbers and the percentages, and then they also break it down by zip code. So this is pretty good information as far as geographic information that I think all of you might find useful. Again, many of the counties in Michigan have it. The statewide EMS naloxone administration is information that's brought in from MyEMSIS, which is all the EMS records that are forwarded to the state of Michigan, and then the University of Michigan then draws from that. And then the fatal overdoses are drawn from those counties in Michigan that their medical examiners participate in the use of what's called MD log. And that is an electronic database that medical examiners use. So in the state of Michigan right now, there's about I think it's about 50% or more of the MEs participate. If you look back in the chat box, I cut and pasted a long paragraph about what SOS data sources are. So it just gives you a quick snapshot of what this whole system is about. Right now, there's about 250 stakeholders that have the login access, and those range from public health to law enforcement to treatment and prevention. So everybody here on this call and everybody applying for the grant would fall under one of those umbrellas. So you'd all get access to it. It's just basically signing up for the password, and after a day or two, U of M will get back with you with your password information. And I would really strongly encourage everybody to access this. This is a great tool, and it's I would call it near real time. Everybody's definition of real time is different, but I'll say this is probably near real time. The EMS records are updated about every 2 weeks. So what you're seeing on the home page here for EMS naloxone administrations is good through June 27th. The MDI log, the medical examiner information, is a little bit more frequent, and the records on the website show through July 6th. So for the MEs, again, those counties that are color-coded on the state of Michigan map, those counties are the ones that do participate in that electronic record-keeping system. The other counties don't. However, most of those counties are pretty low population compared to the ones that do use it. So it does still give us a pretty good picture of the fatal overdose picture in the state of Michigan. Anybody have any questions on that? I know it's kind of hard to appreciate what I'm talking about if you can't see it, but I'll send the information again to Hara after the meeting. And then the other system, if you've heard of it or not, is called ODMAP. If people have heard of the ODMAP system. Access is a little bit more restricted on that, and that is a overdose mapping application system. And you could read about ODMAP on the website, which is odmap.org. So ODMAP, odmap.org. They'll tell you a lot about that. I'm not going to get into that too much in depth because you would have to get access through one of your partner, if you partner up with any law enforcement agencies. So I know Linda Davis with FAN, she's familiar with ODMAP. I think Sterling Heights PD is using it to track overdoses in real time, so they would be able to give her information for their community. The use of the data on ODMAP is more restricted because the data is put in there by the different public safety agencies that directly input the information. So we can't just turn around and share publicly, say for Macomb County, if somebody wanted Macomb County information, we wouldn't be able to share all of Macomb County because that information is owned by each individual municipality that inputs the information. So that's why we direct you to partner with a local agency in your area that uses it, and you can find out who does use it right off the ODMAP website. Right on the front page, you can go to the national map and click on the state of Michigan or use the drop-down list and select the state of Michigan and then select your county, and it'll tell you everybody in your county that's currently using ODMAP. So you'd have to actually contact a local partner, explain who you are, why you want access to the data, and see if you can get together with them to obtain some of their data. So this one's a little more involved in accessing for your purposes. The first system, the SOS system, is really very easy for you to access. So I would really encourage you to follow up with that one. So I can take any questions.
I don't have a question for you, Robert, but once you share that information with me, I'll get it onto the platform for everybody.
Okay.
Thank you.
Robert, could I ask a question? When you hover over some of these, it doesn't really give you any data. Is that because those counties are not active with you in reporting the information, like in Macomb County on the year-to-date suspected fatal overdoses, nothing comes up when you touch Macomb County.
That's correct. Macomb County Medical Examiner does not use that MDI log electronic record keeping system. So
Wow, okay.
yeah, we meaning U of M mostly, they've been trying to get the Macomb County Medical Examiner on board for quite a while, and it hasn't come to fruition. But yeah, anywhere on that map where you see the gray, kind of the gray and white stripes,
Right.
there's no data from those counties. We would absolutely love to get Macomb because they're obviously one of the largest in the state, and that would really, really give us a great, complete, almost complete picture of all of the populated counties.
Do you
So,
know why they're not doing it? Or is, maybe you
no.
can call me later. I might be able to help with that. So
Yeah, okay. What I would do is probably get our public health analyst, Amanda Kogowski from U of M on board. So she's our contract public health analyst for HIDA, and she's full-time at the University of Michigan, and she actually developed this website. So
okay.
we could do like maybe a little conference call. I'd rather have her answer that question.
Okay.
Robert, I would like to ask you one question. What is the population of female between the age 20 through 30? Do you know a percentage?
I think you have to be a little bit more specific on what you're looking for.
What I'm asking you, from the age of 20 to 30, what's the percent of overdose for female?
I've got a breakdown by age, but not.
Okay, can you give me the breakdown between 18 to 22?
Not by gender, only by age. So there's an age graph.
Okay,
there's an age graph.
18 to 20, please.
I can give you.
22.
How about we correspond by email, because what you're asking for, I've got different age graphs. So let's talk by email after the meeting.
Keep it moving _Inc. at yahoo.com.
Yep, and I connected you, Mary. So he has an email from you and me in there. So you guys are connected if you guys want to follow up in that email.
I greatly appreciate it. Thank you.
No problem. Thank you.
I had a question that I was hoping. I'm worried about the time, and so there was something that I wanted to ask about before we get too far in. I'm noticing, a lot of websites and some emails coming through. I wondered, and then when I was registering to attend this, there were a lot of different sources listed, and I wished that I had captured that. So I was wondering about, as a result of attending this meeting, if we could get like a list of the websites that we referenced and we discussed today, because that would help me. I'm really new to data. I'm a program person. So, if I might have a better series of questions if I could kind of play around with the different websites and investigate some of my questions. So would that be an outcome from this meeting that we could have?
We have all of them in an Excel spreadsheet already that's located on the MODA.community page.
Okay.
And so if there's any missing from there, if you guys took the data needs assessment survey, we're going to be adding them to that list. But I believe that there's 13 sites that provide data, and that's always growing. So if you want to add or contribute something to that page, go ahead and drop a comment in the Prevention Network space, and we'll update it for you.
Perfect. Good. That helps me.
And I will share all of the resources from Robert on the dashboard, like I mentioned. And then if anybody needs any additional follow-up, just reach out to me. But I will share all of the resources that we received today on the dashboard.
And if you have any questions on Rita's course after we publish it and you've taken it, you can enter those questions directly into the course and one of us will get back to you as quickly as possible.
Yeah, does anybody have any final comments before we close up? Well, thank you guys so much for attending. I'm going to stop the recording right now.